Hi, my name is Lisset Darnall, and I am going to be teaching you about how to treat major depression with your clients. To start us off, we're going to pretend that a client has come to us because they're really struggling with depression. In this case, we're going to say that the person is a white female who's around 63 years old. And she's come to us because she's just experiencing sadness every single day, doesn't seem to go away. And there's other signs going on as well. She's losing a lot of weight in a very short period of time. She's having a hard time with sleeping. She's actually sleeping too much. She's sleeping a lot during the day. She's sleeping a lot longer at night than she's used to. And her energy is just gone. She doesn't want to do any of the activities that she used to do. And she's just not able to concentrate. And also, lastly, her relationships with people have suffered during this time. She is having a hard time making friends and also keeping her friends. Um, to give her the diagnosis of major depressive disorder, she is actually showing 5 of the 9 specific things that give us information that she's struggling with major depression. And these symptoms and behaviors have been going on for over a 2-week period of time. So that kind of gives her the prize of having major depressive disorder. The other thing too is in talking with this client, she's not using any street drugs, doesn't happen to have medication that could cause these behaviors, or is using or has using alcohol, or is struggling with some type of physical illness. So those types of antecedents are not there in this case. So we can really filter through where her behaviors are coming from. The other thing is that her coping skills and her lifestyle has changed so much from before, when she wasn't feeling this way. Whereas before, she would go to church, she would interact with her friends, and now her personal life is really affected by this depression. With this client, our assessment actually begins before we even see her. Um, this client had called me, let's say, and wanted to set an appointment. And I would advise her to come early um, and fill out some paperwork. And if at all possible, if she wanted me to mail her the forms, then she can fill them out that way, whichever is easier for her. But the 2 forms that I would use to assess her firsthand would be a self-rated level 1 cross-cutting symptom measure tool that I got from the DSM-5, and also the Hamilton Rating Scale of Depression. Both of these tools will give me some understanding on how severe her depression is, the frequency and all of that. Also with the self-rated form from the DSM-5, that's going to give me some more information if we're dealing with other behaviors, other possible disorders, things like that, so we can kind of narrow down on addressing what needs to be addressed. And after that, once I see her, the very first thing I'm going to make sure to do is that I make her feel welcome, that I'm warm, that I come across as someone she can trust, and that I will be very attentive and really care about what she's going through, really build that rapport. I will discuss with her the reasons why I gave her those forms, and that I'll get a chance to look over them before our next appointment, and we can kind of discuss the things that I found in the assessment tools, and just giving her an understanding that why I use them. And then secondly, just give her a chance to share her story, to share what she's struggling most with. But during this whole time, I'm going to be assessing her for her behaviors, for her just her general well-being, her appearance, all those things. And assessment is going to be something I do throughout therapy, not just through these tools or just at the very first session. I will explain to her my style of therapy, which will be a combination of cognitive behavior therapy and interpersonal therapy. I'm going to blend the two because they have both been very effective. Research has shown them to be very effective. But secondly, the combination of the two will really, I feel, would really benefit clients because CBT is very goal focused. There's a lot of homework, and I don't want to lose that personal touch. I don't want to lose that the part of therapy that interpersonal therapy offers. And I just think the combination will be perfect to establish a good relationship and also focus on some goals together. The other thing I will cover with the client is just to see what she expects out of therapy, um, what her thoughts about therapy is, what what she feels is the best outcome after going to therapy. So I'll have some dialogue on that, and also my side of it. What I expect on maybe how long things might take to treat depression. If I needed to give her referrals, talk to her about the combination of medicine and therapy and how beneficial it is to use the two if it's necessary, things like that. So asking her some basic questions, having her have a chance to ask me questions on what to expect. So that's going to be our first two sessions, and like I said, that'll be my approach to assessment, combination of those tools, and also keeping an open mind throughout therapy. So in therapy, we always have to be aware of ethical concerns that can happen and how we're going to respond to those things. Um, First of all, we have to, at the very beginning, talk to our clients about informed consent, and also that we're limited in our confidentiality when it comes to information that we receive that shows that they may harm themselves or someone else. And under those circumstances, we have to break that confidentiality because it affects the safety of themselves or other people. So also, especially if there's a risk of suicide. And this is something to definitely keep in mind because with major depression, suicidal tendencies and thoughts can often be present. So there might be a breach of confidentiality if that is a current situation going on with your client. You also need to maintain appropriate boundaries with your client. Like I said, I really believe in the interpersonal therapy approach. However, I have to make very sure that I'm setting those boundaries where I'm still a professional and that there are lines I won't cross, that maybe the client wants me to cross so that they feel even closer to me or more bonded to me. And I just have to make sure that those lines aren't crossed. So there's a balance there that I have to keep in mind. I have to respect that the client has self-determination, especially with cognitive behavioral therapy. You might come up with these ideas on homework or assignments, and they have a right to say they don't want to do that. They don't want that assignment. So you gotta kind of be very flexible, make sure we are always keeping their thoughts and their wishes in mind. Acknowledging the importance of human relationships of clients while keeping the client and therapist relationship professional. We talked a little bit about that. When it comes to suicide and determining the risk, it's really important that we ask questions so we're not liable if the client does follow through with an attempt. So some questions that kind of safeguard us and safeguard them would be to ask what their history is on suicidal behavior, if they've ever attempted it before, how they've attempted it, how long ago was that, what was going on in their life during that time, what made them decide to go through with it, that attempt, what events, crisis events happened prior to those attempts. How does the client feel during a crisis? How are they dealing with their crises? What are their go-to behaviors when they're feeling completely overwhelmed, seeing if there's any risky behavior on how they're coping with that, and how often do they think about suicide. When they think about suicide, what are their thoughts about it? Are they thinking they don't want to live, or are they thinking of a specific plan? Do they think about the aftermath? What would life be like for those around them? What are their thoughts during those deepest, lowest points in their life? And if they have a plan, to definitely be vigilant in having intervention, so that ethically we can be doing our part, and secondly, because we care, we don't want anyone to hurt themselves. Okay, now that we've had the first 2 sessions on just really talking about her story, building that rapport, covering, I guess, per se business when it comes to confidentiality and expectations of therapy, all that kind of stuff, we start to really dig deep into treatment methods. And in this case, we're going to be treating a client with major depressive disorder with recurrent episodes at a possibly moderate to severe level with melancholic features. Sorry about that mispronunciation. So to kind of give you a background, what cognitive behavioral therapy is, the focus there is to address the client's thinking and behavior patterns and change them to healthier ways of thinking and solving problems. And that's going to reduce depression. Like in our class, we will talk about how our thoughts really affect our feeling. I love the example of asking a client to tell them a story that they had fun doing, an activity that just was a lot of fun or a happy moment. And when they share that, you can kind of relate back to them how they responded in sharing that story, how it made them happy. They appear to be happy, their eyes lit up, their body posture changed, and how those thoughts created these emotions of happiness or joy. So kind of give them that understanding that our thoughts really do affect our emotions. And the approach also has basically 7 steps when covering depression. And the theory is based on the way we think affects the way we feel and behave. Now, with interpersonal therapy, there's 4 domains that that depression originates from. Sometimes it's grief. Maybe this client is grieving a loss. Maybe it's interpersonal role disputes. Maybe she just retired and role transitions. Maybe that's part of it. Maybe she's feeling that she's having interpersonal deficits where she was able to do things before, now she can't, and she's struggling with those problems as well. Those are 4 main areas that depression typically comes from with this theory. And with this approach, I'm going to find out which target domains are triggering these depressive emotions, and those will probably be our areas of focus. The theory is based on the influence of relationship problems creating depressive symptoms. I think this is really important because, at least for me personally, when my relationships aren't going well, it really affects my happiness. And I know that to be true with many other people. So I really feel that this approach is valid because we're such social creatures, and these relationships do really affect us. But before moving forward, I'm going to make sure that she's been referred to a psychiatrist or a physician to rule out any medical issues, to see if she would benefit from antidepressants, so that we can kind of combine these 2 approaches to give her the best therapy to come out of her depression. I'll make sure that she's not struggling with any suicidal tendencies, and make sure that I cover that. In our book, Greg talks about that the core issue in looking for the presence of major depressive disorder is evaluating whether the presenting characteristics are the primary problem or related to another disorder. And that's why we want to do that referral. And people with major depression, they don't bounce back. Like we've said earlier, this client has been struggling for well over 2 weeks, so they just can't seem to bounce back. Symptoms of depression come from both your way of thinking about your situation, but oftentimes it's triggered um, um, by difficulties related to relationships, such as people at work, friends, church, clubs, neighbors, authority, children, spouse, soul relationships, or your parents. So there's a lot going on. So I do feel that this combination, this treatment method, is going to cover a lot of major things that cause depression, our way of thinking, and secondly, the relationships we have in our world. Some things that we do need to keep in mind with this client is her age. Is that a factor in her depression? Her gender, the roles that she's in that have been different from before, if she's retired, if she's moved, or if she's lost a spouse. What other factors do we need to keep in mind? Her personal orientations on what she believes, her belief system. How does that play into her thinking, which causes her depression? Her personal expectations, her personal beliefs, her family's beliefs. Where do all these beliefs play in how she feels about herself, what her expectations are, what she feels should be happening between her relationship with others, and if she's experiencing any social pressures from her family, from society, from the media, from friends that she has, that she should behave a certain way. Finding out what are the factors playing in when it comes to social pressures, and if there's any normal responses to difficult events, like if she just lost a loved one, is she just in that grieving period of time? Or is this something that's been going on before that event? And those are the things that you want to consider. So the first steps that we're going to take with cognitive behavioral therapy is we are going to educate the client that causes her these feelings, what thoughts are going on. I'm going to ask the client questions regarding her thoughts before and during times of feeling sad. So we're going to take a step back and just get her to start thinking about right before she feels a certain way, what are her thoughts? After feeling that way, where does her thoughts lead her? So we're really going to focus on the fact that her thoughts are causing her feelings. So that's going to be step one. Step two, we're going to teach the client journaling her thoughts to kind of pull together if there's any patterns, some self-awareness on her thoughts and her feelings. And when she has happy thoughts, when she has sad thoughts, we're just going to start journaling, or I'm going to ask her to journal events in her day. You know, how she's feeling, what thoughts were happening before those feelings. So this is going to definitely help her to kind of learn more about where her thoughts are leading her. And to give you a little background on CBT therapy, it's going to be an approach where the client and I are going to work together. This is just not me saying, hey, you got to do this. This is what you got to journal these thoughts. We're going to work together so the client feels that we're a team. This is a collaborative effort. And I'm going to be warm and genuine and empathetic. So there's definitely a team effort here. And the role that I play is kind of as a teacher, and the client is like a listener when it comes to CB therapy. And the overall, this kind of therapy is brief oriented, it's very focused, and it can last anywhere between 10 to 25 weeks with occasional like booster sessions, down the road. And so that's a little bit of the backbones of CB therapy. Step 3, behavior activation. Okay, so in this step, we're going to educate the client how her thoughts create her behaviors. It's thoughts, then these feelings, which lead to these behaviors. So I'm just really tying it all together where our thoughts really affect how we feel and behave. So, but we're really focusing on our behaviors in this step. We want the client to talk about activities that brought her joy in the past that she used to do, and how she behaves when she's feeling sad, what kind of behaviors are coming out of those thought processes. And in talking with her, I'm going to get hopefully some information on, the things that used to bring her joy, and assign her those activities maybe 2 or 3 times a week, so that she can really start to feel the benefits of putting her thoughts and her behaviors into action, and how that is affecting her emotions. I would also have her journal how she feels after those activities that she enjoys, and kind of compare with her in therapy how her feelings have changed when doing different activities. The fourth step, which I really feel is important, we are all wired with these personal beliefs that kind of drive us into how we see the world and how we feel about ourselves, how we judge ourselves, how we judge others around us. So in step 4, I'm going to talk to her about her belief system. Does she come from a religious background? What are her family's traditions, her family's beliefs, her personal beliefs? Have they changed from when she was a child, from her family's, from her personal life? Did she used to believe a certain way and now is believing a new way? Everything when it comes to those influences in her life, and just kind of bring to light any irrational beliefs, and if those belief systems are affecting her way of thinking and affecting then her emotions and her behaviors. So that would be step 4. Step 5 will be evaluating those beliefs. We're going to talk about the details of some of those beliefs. What is evident that some of these thoughts are true, that these beliefs are realistic, explaining maybe an alternative way of seeing things, just kind of opening up a broader perspective on some of the beliefs that she has, so that we can kind of bring some rationality to the belief system in the client. Step 6 is testing general assumptions of beliefs. Would the client have those beliefs if she was in a different setting, or is it only with a certain amount of people, a certain type of people? When she's with her retirement friends from where she used to work, does she have those same beliefs and assumptions and behaviors with them, versus when she's maybe hanging out with her neighbors or her church friends? How does that all play with the people she's around or the settings that she's in? And then also, again, teach alternative perspectives on looking at situations and possibly creating new belief systems that are healthier. The last step to treating major depression with CBT is step 7. We're going to talk about termination for at least 2 to 3 sessions before we actually terminate. And in those sessions, we're going to talk about our successes, behaviors that have made her feel better, the activities that she's done that made her feel better. Did the journaling work? Did the other homework assignments work for her? Which ones were her most successful activities? And just kind of keep those in her mind as great tools to use for the future when she feels a certain way. So kind of preparing for the relapse, educating her to expect these feelings to change, but that she can be confident that she will know how to handle it, that she knows what to do, that she can pull herself out. And if not, that she's always welcome to come back to therapy. So we will even just plan just for her own peace of mind, so it doesn't feel like a complete closure of the relationship, that I'll do a follow-up call with her in 3 months and see how she's doing. And if she needed to see me earlier, she's welcome to call me. But just giving her the confidence that she has been successful, that she's had a great time in therapy, learning tools that can be useful for her depression, and to focus on those positives. That's how we'll end the therapy with her. Okay, now we're going to switch gears. Remember, I'm combining CBT with interpersonal therapy. Now we're going to talk about interpersonal therapy when it comes to addressing major depression. So the initial phase, very similar. I'm going to be warned. There's going to be that assessment tool on on where she is with her depression, and that'll give us some tools to diagnose, to do treatment. And I'm going to educate the client that depression is nothing to be ashamed of, that a lot of people have it, that there's no shame in it at all, that she doesn't have to feel that she's weak or that something's wrong with her in a horrible way, but that there's therapy that can help, and that I'm going to instill some hope in her, that we can come up with a plan, that we're going to get through this, and that I'm glad that she's here to talk with me. So the first initial phase is going to be just having her tell her story, elaborate on the details of what she's struggling with, and just kind of make a contract at the end of therapy, maybe after 2 or 3 sessions, on the target problems that we're going to address, and just give her an oral summary back, sharing with her back what I've heard and what she's shared with me. And something like it sounds like the 2 biggest things that are causing you the most sadness is your lack of connectedness with your friends and your low energy. So something like that we've come up with together. IPT is brief, focused, and its time limit typically lasts between 12 to 16 weeks. And I'm going to come across as very warm and non-judgmental, unconditional positive regard. It's going to be kind of laced throughout all of my interactions with this client. The therapist assumes the role of a client advocate, which is so perfect for social workers. We are wired to be advocates. So this type of therapy, really aligns with our field. And so we're going to provide her support, reassurance, be very optimistic, that she's able to change. And that's kind of like our role. That's our role. And the goal is to reduce the depressed symptoms and to improve her interpersonal functioning. So in this approach, her relationships with others is really important, which is also another important aspect with social work. So that's one of the reasons why I want to use this model. And so that's the initial phase. You're building that rapport. You're getting her story. You're zeroing down on maybe 2 or 3 areas that you really want to focus on. Okay, so after the initial phase, you're in the intermediate phase. During this time, we're going to really focus in on the goals that we discussed the previous session. Like in IPT, the relationships in this client's life are important. Maybe zeroing down on a particular person. If it's a spouse, if it's a best friend or a mother, how those relationships are really affecting her joy, and coming up with some goals with helping improving those relationships. We're also going to focus on some of the symptoms she's having with depression, and also identify some intervention goals, maybe some tasks, some homework on how we're going to better that relationship, how we're going to improve those negative symptoms of sadness, and give them a try. Return from the previous week with feedback on how those homework assignments affected those relationships, affected her feelings of depression, and really just focus in on that. If the relationships are strained due to role transition. Now, for example, if the relationship is based, if we're focusing on her relationship with her spouse, has it changed because she's now retired and is more at home, and her role has changed? Things like that. So we're going to dig deep into what's going on, what changes have happened, and assign some intervention to kind of improve those problems. Okay, so now when it comes to steps to treatment, we're going to discuss on this slide methods. The first thing is exploration. We are going to use the right questions that are going to help us gather the information we need to figure out what the client's problems are, what her symptoms are. We're going to promote and encourage her to be expressive about her experience, even if they're painful, especially if they're painful actually, and joyful. Just really open up this conversation and encourage her that we want to hear it all. We want to know the details. Also, another method is communication analysis. We're going to break down what went on in communication with maybe the relationships in her life that she's having struggles with. Discuss maybe assumptions on our interpretation of what was discussed, how our responses may have been interpreted, why the responses were given, what were her thoughts and feelings when she decided to respond a certain way, and just discuss alternative interpretations to the different dialogue that's happening in her life with the people that she's having problems with, connecting with. Another method is clarification. Ask the client to rephrase what is said, address unusual beliefs or inconsistencies. We're going to talk about behavior change and techniques. This method is really helpful, kind of goes along with CBT. We're going to assign homework to encourage behavioral changes, educate, model, and role play. Maybe this is something we can do in therapy, which I find could be very beneficial. Kind of get that practice, kind of get a chance to do a redo, I guess. Sometimes we have these thoughts on how we're going to say something to someone, and once we say it out loud, we realize, wow, that would not be what I want to say. That comes across wrong. So role playing can really help with that, and maybe relieve some anxiety. Role playing it out instead of just doing that one time shot, and those emotions arise, and then it doesn't get delivered well. So role playing can be helpful. It's a great method. Client decides on changes made. So that's something to keep in mind. That's an ethical issue. We're always going to talk with them about homework assignments, but they have the right to say, you know what, that's not going to work for me. I don't want to do that. I feel uncomfortable with that. Then we brainstorm and think of something else. We will use a therapeutic. We will use the therapeutic relationship to get open and genuine interactions. So that's really a part of IPT that I find great, is that the relationship with the therapist is very powerful when it comes to helping a client, and just being genuine as a therapist will allow for the client to open up and be genuine, and then we can really work and move forward because of that openness. So those methods can be used in IPT. All right, so we are actually at the last step to treatment using IPT therapy, which is the termination phase. So this also, like CBT, you're going to take maybe 3 or 4 sessions to kind of prepare the client for termination. Especially, this is especially important in this type of therapy because the bond is so strong. Usually clients have really developed an intimate relationship in a healthy way with their client, with their therapist, and so giving them that time to transition is really important. So it's recommended that you do the last 3 to 4 sessions to kind of prepare for that time where they're on their own and they're using the tools that you've taught them to keep them not feeling depressed. The client is given an opportunity to express her feelings about termination. This is part of that relationship where that honesty is just out there. There's just this transparency, asking your client, how do you feel about terminating our time together? How do you feel about we have 2 more sessions left? How does that make you feel? Help the client grieve losses, failures, or or hardships. Maybe if it's with the role transit, having grief over um, a change in roles in her life, that she can grieve that part of her life and then look hopeful and happy to the new role that she plays. The therapist encourages the client that they are capable of coping independently, bringing to her memory her successes, maybe bringing a story up and saying, "Hey, you remember when you felt this way, and you handled it doing this activity, or said this or did this with that person, and how it's made you feel, and now look at your relationship with that person, or how good you feel now about being in this new place in your life." You're going to bring up these successes, um, and the gains, like at putting it all together in a summary. Kind of give her kind of like a story of your time together since you've started therapy. That's going to give her that feeling that therapy worked, that she has learned wonderful tools that she can use in her future, and she doesn't have to be afraid or feel alone in dealing with her depression, because she's this new person. She's this um, new person with these new skills, that she has this handbook bag of tools that she can go to if she does come across a hard time in her life. So you're preparing her for some setbacks too, because life, being honest with her, life is going to throw you those curveballs. But now she knows how to swing that bat and hit that to outfield and run those bases. So now we are finishing up, and these are the references that I have listed here on the books I've used to gather this information. I actually can talk a lot more about all of this, but I've already ran over my time by 7 minutes. But I just hope that you find this presentation helpful when it comes to dealing and treating major depressive disorder. Thank you. Sorry, I actually have one more slide for you. This is just a description of each of the references I used and why I used them. Hopefully you find it helpful.